Hello, I'm Tanmay Bengali, a PGY1 internal medicine resident, and I'm honored to present our project titled Resident Physician HCAHPS Initiative at Northeastern Health System. This was a resident-led QI project effort by myself, Dr. Connor Polson, PGY2, and Dr. Landon Frank, PGY3 Chief Resident. We also want to acknowledge the key contributions of Dr. Ashraf and Dr. White, who were PGY3s at the project's start and have since graduated. We're grateful to Dr. Stacy Larman, PharmD, our faculty advisor, and to Dr. Mosteller, our attending physician whose leadership helped anchor this project. Going into the background and aim, historically, HCAHPS feedback was collected by mail, resulting in very low response rates. More recently, digital surveys were adopted, but like other hospitals, this created initial inconsistencies in data capture. With such low response volume, a small number of surveys could drastically shift reported satisfaction scores, making it difficult to track consistent trends. Nevertheless, the data are used nationally to benchmark performance. At baseline, our doctor communication score was only at the 31st percentile. Because this domain is one of the few where physicians have direct impact, we set a clear aim: raise our doctor communication percentile to at least 50th percentile using resident driven, low cost, high frequency interventions. We use iterative PDSA cycles beginning in fall 2023. Our interventions included monthly resident led and attending supported didactics focused on communication techniques with major support from Dr. Mosteller. We designed monthly HCAHPS tip posters placed in high traffic work areas, emphasizing AIDET principles, active listening, and patient education. We also use positive reinforcement. If a physician was named positively in a survey, they received free coffee. We emphasize percentile tracking instead of raw score changes, which helped residents understand how they compare to national benchmarks and made progress more tangible despite low sample sizes. Going into the results, from a starting point around the 31st percentile, our doctor communication percentile improved steadily, reaching as high as the 77th percentile. For 4 consecutive months, we maintained scores at or above the 50th percentile. All three subdomains, courtesy, respect, careful listening, and clear explanations, trended upward. These improvements represented a 246% relative increase in percentile rank. We did face several challenges. The small number of surveys each month introduced a significant issue. The transition from paper to digital surveys led to inconsistent participation early on. We also could not immediately reach all physicians. Our interventions primarily focused on internal medicine residents. Despite this, we demonstrated that consistent education and feedback can produce measurable, sustainable improvement. Going into the practical impact, we know that education works. Awareness and visual reminders reinforce communication habits and fostered buy-in. We also learned that culture change begins with consistent peer-led action, and improved physician-patient communication translated not just higher survey scores, but to better patient understanding, engagement, and ultimate safety. This work helped connect the dots between communication and clinical outcomes, something often talked about but rarely quantified at our level. Moving forward, we aim to sustain gains by integrating HCAHPS education into intern orientation and continuing tip posters. We're also working with leadership to extend these tools hospital-wide. While the formal project has concluded, the cultural shift continues. In closing, I again want to thank our team. This work demonstrates that resident-driven change can meaningfully improve patient experience. Thank you for your time.